using during the
Yes, doctor.
injections?
We do have a lot of patients now that underwent that what you call silicone oil injection.
Yes, silicone oil.
It is usually available in the black market.
Is it really silicone? I mean, is that really an oil? I mean, how do you assess that this is a silicone? Maybe, ako I could say it's a mineral oil eh.
The consistent, I've seen one. The consistency, it's more like the Harris Black, the one that you use for blackening the tire.
Oh, man.
Wow.
That consistency. Imagine that
Yeah.
going inside your nose, your one and only nose, for a not even a doctor. Parlors, sa apartments,
beauty salons.
yes.
Estheticians.
Sometimes they
Yes.
do it themselves, diba?
Yes, they
I've
do.
seen
Uh,
some cases.
I don't know how these patients are convinced by non-doctors.
Uh-huh.
So it's very important to have your nose job sa certified doctors. You should be meticulously in finding the right doctor for you. So what we do, if we encounter patients that underwent already silicone oil injection, we remove all of it. We scrape it off. But the thing is, our results is not that ideal of the virgin case,
Comparison with the
compared
virgin case,
virgin
right.
case, because the skin of the patient that underwent silicone oil injection, medyo bako-bako na, doctor.
Okay, right. How about you,
That's
Dr.
very
Abeleda? Do you have any other material like other than the oils?
Yeah, paraffin. You know, the
Paraffin.
material that is
Candle.
being used. Yes,
Wow.
estheticians usually inject it in a liquid form
Yes.
inside their nose, and then afterwards the liquid material is solidified.
Okay.
So the result is like an even, hunky, fluffy nose. So what we usually do is we scrape it off.
Oh,
As
okay.
much as possible. We get the paraffin, and then as what Dr. Mark has told us, the result of the procedure is not that ideal.
It's harder.
Yeah, it's very
harder.
hard.
Because I know that if you don't remove this injected material, like even an oil or a paraffin, you're like a walking time bomb. Eh? That anytime, because these material are not for human consumption.
Yes.
Let's face the reality.
Yes.
That
Yes,
these material are not really meant for human consumption. And imagine, it will be injected into your nose. And the people who are doing this are those people who are not even doctors. They're not
Exactly.
even in a medical field or even nurse. You know,
Exactly.
you're not allowed to do that. But because siguro dahil it's cheaper, and there's a lot of patients who wants to become beautiful, and then they grab this kind of opportunity, and sometimes they don't even have a clinic, di ba?
Yes.
They even
Beauty
do it
parlors.
The beauty
beauty
parlors,
parlors or
even
Sa bahay.
inside
Sa
the car.
bahay.
yeah, inside the car. Man, that's not right. And I just want to warn our televiewers, if somebody came to you for having this kind of procedure, that they will do an augmentation or pagpapatangos ng ilong, doing injecting an injectable material that's not really meant for human consumption, like the oil and the paraffin.
Paraffin
Imagine
wax.
you have this kind of procedure, and it's very hard to remove, di ba?
Yes.
Dr. Fernandez, you said that, and even you remove it, doesn't look good after.
Yes, the skin is very much damaged by the silicone, because the silicone goes inside under the nose, the dermis, under the muscle, under the right above the bone. So it's scattered all over the layers of the skin.
Yes.
So it's hard to remove really.
Okay. Oh, we have a texter from Pauline.
Pauline.
Yes, Dr. Jonna.
Okay, she says, "Good morning, Doc. Ask ko lang po how much ang nose lift and saan clinic po kayo pwedeng ma-visit. Thank you."
Or maybe, Pauline, we will tell that later. The prices and
Yeah,
the
we're gonna discuss that
addresses of our doctors.
Kaya
of our
stay
experts
tuned.
here. Stay tuned.
Don't
Stand
go
by.
away.
But by the way, if you have more questions or comments, and please text us at 0922 891-6761. Please indicate your name and
Where you're from.
Where you're from, your location. And our topic for this morning is all about noses. I mean,
Yes.
I told it is doctor knows best, no?
Doctors know.
Ikaw,
Doctor knows best.
Dr. Abeleda, okay, when you a patient come to you, consult for a nose job, and do you have like you're the one who could assess the patient,
Yes.
because we know that patients come to you, minsan di naman nila kailangan lang yung nose lift, no? Sometimes we do trimming, no? They thought that it's just a nose job. How do you convince your patient and tell them in a nice way? Because sometimes, kasi there's some patient tatanong sa'yo, Doc, pangu ba ako? Minsan gano'n eh. So how do you manage that, Dr. Abeleda?
Usually when a patient comes to you and your assessment of the patient is like he has like a wide ala, meaning the leaf of the nose ito.
Yes, yes,
So
yes.
medyo malapad yung ala. So of course, you do not you tell them that, for example, your face is big. You focus on the face in totality. The face in totality, and you enhance the beautiful aspect and of the face, and you tell them, it seems that your nose is a little bit not awkward compared to your face.
Okay. So
Something like
you say it in a nice way.
Yes.
How about you,
say-
Dr. Fernandez? How do you
I always tell my patient that beauty is all about symmetry and harmony.
correct?
Which
So,
is true. Yeah.
We have this, sasabihin nila, Doc, yung ganitong katangos ng ilong, ito yung maganda. Of course, beauty is in the eyes of the beholder, and it's relative. So we do have standard measurements of beauty. So we take the picture of the patient, we analyze it, and we show her or him the fine points. If we do rhinoplasty, yung eyes mo mas gaganda, babagay sa cheeks mo. Certain things like that.
Do you also complement it with other procedures? Let's say if they thought that it's just a nose, but actually you have to do also the eyes for them to have a nice.
Yes, doctor.
You recommend
The nose is in the center of the face. Pag nagawa na siya, sometimes yung chin natin usually naiiwan. So,
So it's retracted.
retracted. So you need a complementary additional chin augmentation. And of course, to enhance the eyes, if you have eye bags already protruding, of course, blepharoplasty will also be complementary to the nose lift. Yes.
I just have one question. If ever a patient comes to you and she wants to have her nose done, could you also recommend that you do the chin augmentation, the eye bag removal, all at the same time? Is that possible?
That is possible, but here in the Philippines, the problem is yung financial.
Right.
Sometimes, napag-ipunan lang nila is for the nose lift, but it's very important to tell the patient, inform the patient na it will be better or it will enhance more if we do the procedures. Pwede
All at
naman,
the same time.
all at the same time. 1 week downtime, isang
Yes.
sakit, one-time antibiotics. Pero due to financial constraints, pwede namang stages.
Yes.
Oh, well, okay. When we talk about the financial aspect of cosmetic surgery, and that's a very interesting topic. It's very important, actually. We have already one hanging question regarding the financial aspect of cosmetic surgery. We will discuss that when What's Up Doc returns. Yes, and we're back here in What's Up Doc as we're discussing all about rhinoplasty, or we call it Dr. Nose Vest. Ito po yung tinatawag na nose lifting or nose job for those patients or viewers who wants to undergo this kind of procedure where the nose is actually located in the center of the face, and this is one of the most important part in terms of beauty angle of a person. And we have our two experts from Janssen and Simian, Dr. Lester Abeleda and Dr. Mark Fernandez. Of course, my co-host, Dr. JONNA Cenica. And we have a lot of hanging questions regarding
Dami ng
nose
texters.
job or nose lifting. And Our cell phone number here is 0922-891-6761, and please indicate your name and location where you are right now. Okay, let's start again, the ball rolling. Dr. Fernandez, there's a lot of questions regarding how much do you charge for a procedure in rhinoplasty or nose job?
So, right now, dati kasi pag yung daughter hihingi ng gift from a dad after graduation.
Especially right now, it's Father's Day.
Father's Day.
Yes.
Kadalasan, they ask for braces. Sa ngayon, rhinoplasty na ang hinihingi.
Braces are for the
Yes,
90s
yes,
na
for
daw,
the
diba?
90s.
For
So,
the 90s
90s,
na daw ang
For the
braces.
2000, it's rhinoplasty. And the price is not that far from
Not really
It's
that much.
just
that
like a
much,
cell
yes.
phone.
just like a high-end cell phone or an LED TV, flat
Oh,
screen
Or an
TV.
iPad?
Or an
Or an
iPad for
iPad.
that matter.
Baka
Yes.
nga mas mahal pa minsan yung mga high-end cellphones natin.
Yes,
eh, no?
mas mahal yun.
And when you say the price is like a high-end cell phone or an LCD TV, and it only lasts for like what, 2 years, 4 years, and after that you have to change it to another model,
Yeah.
Yes.
right?
Ang
And
bilis
we had a
mag-upgrade.
rhinoplasty, Dr. Abeleda. This is lifetime, right?
Yes.
Ito po I mean, when you had a nose job, you don't need to change the implant for after 10 years, or may expiration ba to or what?
Actually, the implant, like for example, the silicone implant for that matter, as well as the Gore-Tex, wala itong expiration.
Okay.
It will be there for as long as you live, provided walang complications, walang extrusion, something like that.
At least,
So,
diba? Hindi mo
magandang
kailangan
investment,
mag-upgrade.
di ba, Dr.
Yes.
Mark?
Yeah.
Magandang investment.
It's a good investment. no?
Yes, of course.
Yes. So, that's right. And alam mo, we know that face is parang, ito yung sa dyaryo, front page to eh.
Yes.
So, ito yung, this the first impression. You know, as I have observed, even though how nice your eyes, flawless skin, kissable lips, but the nose doesn't fit the face. Mukhang ano eh, the patient or the person doesn't look like ano eh, parang expensive eh. But once you have a nose job and because we know that this is the center of the face of a person, even though it's not really that much, the eyes, the lips or the skin doesn't look that much, but you have a nice nose. You
Pag
look like
matangos ang ilong,
parang
iba eh.
especially here in the Philippines, ha? Especially here in the Philippines.
Tsaka sabi nila, Dad, mas masarap daw mag-shades kapag matangos ang ilong mo.
Yun.
Diba?
Diba, isa sa, exactly.
Actually, kadalasan yan ang sinasabi ng mga patient, Doc, gusto
Totoo
ko magpa-rhino kasi
yun.
pag nag-shade ako, bumabagsak yung
Bumabagsak.
shade ko eh. So,
Oo.
Doc, pwede bang medyo mataas-taas?
Even though how expensive is your shades, ha?
Yes,
Kasi yun,
yes.
napakaraming magaganda shades. And as what you have said, that Joanna may said that.
Mas masarap mag-shades.
Why? Do you have an experience like that?
Well, actually, yeah. Actually, me myself, I had my nose done like around.
Really?
Yes.
Oh, that's a
Yes,
big
Dad.
revelation.
Do you remember?
Big revelation.
Can you focus that?
Oy!
Direct?
No, stop it.
Who did your nose, Dr. Cenica?
I think the person's right here. Yeah, I actually had my nose done like around 2 years ago, and actually my nose wasn't that flat naman talaga. But I wanted to enhance my nose, and I was like, siguro just less than a month before my operation, I said, what if I have my nose done? Kasi since like andyan naman si Daddy, ganyan. But I was thinking, sige, tingnan ko nga. And then one time, I went to the clinic. Sabi ko kay Daddy, okay Dad, I wanna have a nose lift. And he was like, huh? Talaga? Parang, kailan pa? Parang gano'n. Kasi last na naman tago eh. Saka ko lang siya naisip. Then, uminom na ako ng pre-op meds. Humiga talaga ako sa clinic doon. At sabi ko, okay Dad, after ng clinic, ako yung gagawin mo ng nose lift. Then there, I probably recovered like, I had swelling for my first 2 days. And then on my 3rd day or 4th day, nasa mall na ako. It's true. Nasa mall na ako. Although may minimal swelling pa. May minimal swelling pa ako on the 4th day, but still you could already go to the mall or places with just not too much extreme activity.
How about the pain?
How about the pain?
The pain, well,
As a patient, okay.
As a patient.
Can you give
okay,
us the story?
sige. So ako na yung guest nyo ngayon.
Story
Yes.
We're
of
discussing
Yeah.
about nose
Okay,
job or
sige,
nose
sige.
lifting. Ha?
This is
Okay.
a testimonial.
Testimonial. It's the first time in the Philippine television history
My
that a patient
I wasn't ready for this.
talk about rhinoplasty. Okay,
Oh,
a
well,
doctor talk about rhinoplasty, who's a
I
patient
mean,
also by.
It's okay with me that that I'm talking about the rhinoplasty because actually, 'di ba sabi nga natin, it's already a trend. It's